Do you know what the #1 killer is in developed countries? Well, if you didn't know, it's heart attacks. According to Sharon Carter, 1.5 million Americans have a heart attack each year. I have researched heart disease and heart attacks. Today I'm going to talk about the causes, symptoms, and treatments for heart disease. According to Neil Eisenberg, there are controlled and uncontrolled factors that go into having heart disease. Some uncontrolled factors are your age, gender, and your family. In this diagram here, it shows that the older you get, the higher chance you have of having heart disease, and males have a higher chance of having heart disease. Some controlled factors that you can control are smoking and obesity. You need to watch what you eat and try not to smoke. Most of these factors have to do with your cholesterol levels. Cholesterol builds the cell walls in your heart, so if they get destroyed or if you have low cholesterol, then it could lead to heart disease. Some symptoms are important because there are many causes, so if you have a symptom, you want to be able to get to the doctor as soon as possible. The #1 cause of heart disease, or the #1 symptom of heart disease, is having a heart attack. So, according to Sharon Carter and Dorothy Lee, symptoms are feeling compressed and having shortness of breath and blueness of hands. Another thing to know with symptoms that they also said is if you see symptoms in yourself or a loved one, don't try to be a hero and don't try to do CPR or anything, just call the professionals and let them handle it. So now that you know what to do, now that you know when to go to the doctor, here's some of the things they may have you do. There are 3 main treatment options. The first is surgery, the second is medication, and the third is to take care of yourself. Surgery is often risky, and many people try not to do surgery because they don't want to risk it. The second is medication, and if you have surgery, you may have some medications that you need to take after, but most of the time the surgery might handle it, but there are also medications to take instead of surgery, so many people often choose that route. And the third thing to do is take care of yourself. Like I said earlier, smoking and obesity and stuff like that, you can control yourself. So you can control whether you have heart disease or not, most of the time. So in conclusion, I have explained a lot about the causes, symptoms, and treatments of heart disease. I hope you are now informed and know what to do if you're ever put in a situation where you need to know what to do with heart disease. Imagine if you could save a loved one's life if you knew what to do when you saw the symptoms of having compressed breath and the blueness of hands and things.